Well, at Finlandia Pharmacy, we want to give the patient the best of both worlds. So we do specialize in natural medicine. However, as a pharmacist, with the Western training, we don't want to discount the traditional medication as well, because the medicine does have its role in therapy. More specifically, Western medicine can be very, very effective in acute cases. It can potentially save people's lives. Like for example, having a heart attack, having an asthma attack, or an angina attack. We're not going to be using herbs. We're going to be using the Western medicine. My area of specialty here would be like with the bioidentical hormones, which is just basically a fancy name for natural hormones, and they just basically mimic your body's own hormones. And we have a program here set up where we can help clients, both men and women, manage their symptoms. And men do go through what we call the male version of menopause, called andropause, and obviously women go through menopause and perimenopause. We do initial assessments here. We usually have a program here that's geared more towards the client who has a doctor who's open to the hormones, but maybe not quite sure what to write. And what we would do is we would work together with the doctor and the client on finding them the right balance of hormones. Having said that, there are like many doctors actually out in the Lower Mainland who do specialize in this area, and we do recommend them frequently and from time to time if the patient is interested. The main benefits would be, now there would be the short-term and there's also the long-term benefits. The short-term benefit is for women, it usually very helpful for the hot flashes and night sweats. Those are kind of like the two main symptoms that women find most disturbing and concerning when they hit menopause. Some women might be getting hot flashes, say like every hour or so, right? And the long-term benefit is it actually helps to slow down the aging process, and it can be preventative for heart disease, osteoporosis, and also for Alzheimer's. Ideally, you want to do some kind of testing, whether it's through saliva or urine testing, and you want to collect a good patient history. And then based on the testing, the lab work, along with the patient's history and also their symptoms, we come up with an action plan. So as a pharmacist, we are able actually to run these tests and help the clients interpret their levels. You do see more and more compounding pharmacies. So it's before there were like far and few compounding pharmacies in the Lower Mainland. Now you're starting to see a few more. There's still not like a lot of compounding pharmacies, but it's definitely growing. Well, I think with the hormones, it's really picking up. I think compounding pharmacies were popular for other types of preparations aside from natural hormones. But now, I think because more doctors are into it now, so you're seeing more prescriptions. So consequently, there's more compounding pharmacies. We do see some men. I have to say that we do see a lot more women. I think it's just in general. I think females tend to be a little bit more proactive about their health. Men tend to be a little bit more lackadaisical and maybe not quite as proactive, and also the symptoms tend to hit women much more hard. Like once a woman reaches like age 51, which is the average age for menopause, you're getting the hot flashes and night sweats, right? And they're quite disturbing, and they really affect their quality of life. Whereas with men, it's kind of like more of the ball's kind of like just rolling downhill at kind of like a steady pace. Whereas with women, the ball's kind of falling off the edge of the cliff.